Good afternoon, everyone. Let's take a moment to reflect on the term burnout. You hear that a lot. Burnout was coined by a visionary American psychologist, Herbert Freudenberger, in 1970s. When he initially used the term, he was referring to professions, like helping professions with healthcare people. Why? Because of the crushing needs and the severe stress and high ideals. Nowadays, it's a universal language for the dark side of self-sacrifice. Raise your hands if you're not taking care of someone or not dealing with something stressful in life. Day-to-day living, thank you. Day-to-day living is ups and downs, and we all know that. So with that, we realized over time that burnout does not discriminate. It affects everyone, including our educated teachers and student athletes, working moms, and our homemakers, and also the glitzy world of the celebrities. They're not immune either. Okay? What is burnout? Burnout is very hard to describe. If you look at multiple data and definitions, there are a bunch of definitions out there. Burnout is that relentless, looming cloud over your life. It's that tossing and turning in bed, just unable to get back to work the next day, or not interested or motivated to do anything. Second thing with burnout is the quicksand of emotional exhaustion. You want to get out of it, but you just try as hard as you can, you somehow feel like you're stuck in it. And you know what? Burnout takes the liberty to invite unwanted guests of cynicism and self-doubt. Now, we can talk all about burnout, but let's talk about numbers. Numbers speak louder than words. Based upon multiple studies and surveys, more than 50% of working moms, more than half of youth athletes are currently facing the brunt of burnout. 50% of patient caregivers, those who are caring for the loved ones with cancer, Alzheimer's, dementia, are currently facing burnout. 20 to 30% of financial and professional sector employees are in the same boat. Now, there's more to it. What about healthcare workers? Because that's who I represent. It's a blazing inferno. More than 60% of us are burning out. And another important factor, more than 60% of these people who are burnt out in healthcare sector are contemplating leaving the field. And there's a lot more studies going on to look at what can we do to change the platform in medical field. Friends, no one is immune to burnout. Now, as fellow human beings, I'll ask you, walk along the path with me. Let's question ourselves and say, why do we care if a physician or a nurse or a healthcare worker is burnt out? Do we really care? It's their problem, right? It becomes all our problem because data has shown devastating effects. Burnt out healthcare workers mean low quality care, poor patient care outcomes, and higher medical error rates and malpractice risk, and for the healthcare systems, high staff and physician turnover. And you know what? Burnout increases the risk of depression. So as the depression increases, suicide rates go up. Let's take a guess. What are the rates among the physicians in healthcare suicide rate when compared to general population? It's twice likely. So twice likely that physicians and nurses can commit suicide when compared to general population. So burnout is and can be a fatal disorder. I gave you the story as an outsider. I'll dive in as an insider now. If you bear with me, I would like to share an anecdote. Just like our lives were basically jolted by the COVID pandemic, we felt like we were pushed to the back of the stage. We had no control. Changing policies, stressors, mass suffering, and we were just like, okay, what's coming at us? How do we find that equilibrium? We were shifted off our status quo. Just like the COVID that shifted our status quo, my life for a moment got jolted with an incident, and I would like to share that. It was a routine day at work. This was several years ago. I was finishing doing a procedure on one of my patients, an elderly gentleman, and I love my patients, I love my job, okay? So I was finishing that procedure. Everything was going great per the routine. For reasons unknown to me, fire broke out in the procedure lab. My patient was on the fire. The whole room was on the fire. And I am the clinician with support staff and my colleagues. I had to make a quick decision to get my patient, and that was the priority for me. So this patient, mind you, is sedated, so he was not awake. So I rolled him over off from the table, asked my colleague to help me, screamed for help, get blankets, let's roll him in blankets, and physically him through the corridor to safety. The whole room was filling with smoke, soot, and I still remember, I was feeling I'm getting short of breath, but I told my mind, you cannot give up, you gotta keep going. So saved the patient, put him to safety, handed over to other colleagues, went back running into it, because next to that procedure lab is a waiting area with another patient and his spouse. Elderly people, they didn't know if they could move, what can they do? So I ran up to them with my colleague, and I told my colleague, you need to save the wife. She's smaller in frame, and you're already short of breath. You need to take her to safety, drag her to out the corridor. And he did that. In the meantime, this gentleman I'm looking at, his intravenous IV line made of plastic is melting. I ran to him, I grabbed the IV line out, held pressure on his arm, stopped bleeding, and he wouldn't move. He was in a shock, just like all of us would be. I screamed at him and I said, if you don't move, you're gonna die here, and I will die with you. I don't wanna die with you. And we need to move. And I repeated that. Ultimately, somehow or the other, my words probably sank in. Physically, literally physically, he's a very tall man. I had to drag him through the corridor to get to the safety. Afterwards, we found out that there was a fire drill going on in the hospital. And that was the reason for the delay of the fire marshals coming. They came, they helped us. But by this time, I sat on the floor and thanked and said, my patients are safe. I can breathe now. But we were taken down to the emergency room. We got exceptionally good care for the smoke-filled lungs. As I sat in the emergency room, I thanked and I said, I'm in the right place at the right time. I helped those I really care for. But I didn't tell you another secret. There was a secret in me that I never shared. Other than my husband and I, no one else knew. I was pregnant. I was in first trimester. And I sat there and I started to bleed in the emergency room. I lost my pregnancy. So as I sat there, I thought, wow, on one end, I'm very happy that I saved my patients. On the other end, I lost my pregnancy. Mind you, I'm married to a wonderful man who is an interventional cardiologist, and I know how hard his life is. So I never called him about my horrible day. I just sat in the car as I was released from the emergency room, drove home later that night, and I took shower, sat on the couch at home. And then he comes home, my husband comes home and says, do you smell smoke? Something is burning in this house. I said, come over, nothing is burning, my hair is burnt. And that's when I told him, I unraveled my story for the day. And I told him, I have success, I genuinely care about my patients, I saved them, but I'm also mourning the loss of my baby. And so he asked me the key question, do you think you're ready to go back to work the next day? Stubborn me, I said, yes, I want to go back to work next day. I want to check on those patients. I want to check on my other patients. I need to go back. So I went back. Next few weeks transpired. I noticed, people around me noticed, and said, you look a little bit more tired than normal. And I would go to the bathroom if a patient is very sick. Usually I handle it very good. But suddenly I started to tear up more. And I was like, what's going on with me? I'm a little bit off balance. That was a warning sign for burnout. I didn't stop. I continued over the next few weeks, and it took a very small incident to basically open up my eyes, saying I need to take proactive steps to prevent me from falling off the cliff. And that night, I went to a patient's room and just to see them for rounding, to check on them. And the family was very upset with me, and they said, where were you? You didn't come all day. We've been waiting. I could not open my mouth to say I didn't eat all day, I didn't drink all day. Probably I didn't use restroom all day, and I've been doing procedures all day. Well, I just said, I'm so sorry, and then I apologized, honestly. And then I went back to the car. It was dark outside. I sat in my car, and of course, I called my best friend again, my husband, who is full of wisdom. And I said, then I accepted. I said, I think I'm burning out. I think I'm going through emotional exhaustion. And he basically said, I need you to take time off. So with that story, how did I change my life? And I made intentional effort. I urge all of you, evaluate your own lives. When the storm comes, be prepared and be intentional how you embrace the pathways to well-being. First thing is family and connection with them. Now, I made it a priority that I would go out with my family for dinners every other week. That's on the calendar. Doesn't matter what games you have, doesn't matter what you need to do. We need to have family time, and that's Friday evening. I don't ever sacrifice unless I'm on call. And practice a lot of introspection. Meditation might work for you, deep breathing might work for some of you. For me, it's that moment of silence. I like to sit in a room, just process. Someone earlier today mentioned about introverts. I am an introvert, and I portray extrovert. So I kind of sit in a corner, offload the sensory overloads, and say, what is my purpose for today and for years to come? Second thing, which I wasn't doing a great job, I love to swim. I've always been a swimmer. I went back to swimming. I got into my routine, and I made sure I ate, I hydrated myself. I realized my body is not a robot or a machine. I need to take care of it. And then time. Another thing, as I grew older, I have trying to become better at it. I don't know if I would call myself as an expert, but I have learned to say no. Many commitments come, whether speaking engagements, write a paper, a project, or social outing with a group of friends. I love friends, but I also need me time. So I prioritized, set boundaries, and learned to say no, a polite no. And gratitude, even on that day, I had gratitude as my ally. Gratitude is very important. Be grateful every day to thank someone in your life and feel it. That will have a positive feedback to you. And allyship. So I only focused on me so far. I took this out and said there are many other people around me who are suffering, and that's where we wrote books. I go and give lectures about what are the pathways for well-being. So bringing allyship, bringing the faith in. And then I've always been interested in safe houses and abused women's shelters. I've done that for as long as I can remember. So I went back full force, started raising funds, and became advocate for those women, working with the pro bono lawyers to help these women get back on their feet after the abuse. And fun, don't forget, life should be full of fun for those young ones out here and older ones like me out there. Fun is important. I made a little corner in my house, even now I have it, where I write my poetry. I have a journal labeled as gratitude, forgiveness, things to improve, and I work on that every single night. My routine is the same. Doesn't matter whether I get home at 10 o'clock or 9 o'clock, doesn't matter, or early. I do write my journal. That's my best friend. And play games and watch movies, maybe fun movies. But those are some pathways to well-being. And with that, dear friends, just evaluate your own lives. Take one day at a time. Help others around you and make the best of it. Thank you.